So thank you for coming today. My name is Dr. Bridget Harrison. I'm a professor of political science and law here at Montclair State University. And I want to thank you and congratulate you for coming out today. This is a really important debate. I don't mean just here today, but I mean in society in general. When we look at some of the statistics out here, what we know is that this is one of the biggest and most important public policy debates taking place, not just in our state, but in many states and throughout the country. And so thank you for coming and hearing both sides on this important issue. I wanted to start off talking about a couple of the rules of the road. We're here to learn, and we're here to advocate. Let's be civil in how we do that. We would ask that you be respectful of everyone's opinions, that you applaud certainly, but allow people to have their say. We need you to have your cell phones out, but we ask you to please turn them to silent so that the presenters are not interrupted. You'll see, and you have seen as you are sitting here waiting, some instructions on how to make this more participatory. And so we'll be asking you throughout the event for different opinions on various issues, asking you to partake in different polls and even feed some questions to our presenters today. All right. So now that I've welcomed you, kind of given you the ground rules, I would ask that you hold your applause while I introduce our presenters. But first off, I'm going to turn to my right. To my immediate right is Ken Wolski. Mr. Wolski is the Executive Director of the Coalition for Medical Marijuana of New Jersey, Incorporated. He received a Bachelor of Arts degree in philosophy and a master's in public administration from Rutgers University, and graduated from the nursing program at Mercer County Community College, becoming an RN in 1976. Ken worked as a registered nurse in New Jersey and Pennsylvania for the past 38 years, and he volunteers full-time as executive director of the Coalition for Medical Marijuana. Ken, he was instrumental in passing the Compassionate Use Medical Marijuana Act into law into 2010, and he's a founding board member of the American Cannabis Nurses Association and a board member of Normal, New Jersey. To Ken's right is Ari Rosmarin, who's public policy director of the American Civil Liberties Union of New Jersey. He manages the organization's legislative and policy campaign work. He focuses on advancing public policies that promote and defend civil rights and liberties throughout New Jersey, including immigrants' rights, privacy, voting rights, and working to build a fair and equitable criminal justice system. He has worked on drug policy reform in the United States and internationally, and was co-author of the 2012 study, A Quiet Revolution: Drug Decriminalization Policies in Practice Across the Globe. Prior to joining the ACLU in New Jersey, Ari was the senior advocacy coordinator at the New York Civil Liberties Union, where he worked to reform New York's discriminatory Rockefeller drug laws. He is a graduate of Columbia University and the Brooklyn Law School. And then finally, to my far right is Michael Hazukoff, and he is the outreach coordinator of Normal, New Jersey. He is a graduate of Ramapo College of New Jersey Law and Society program and received his bachelor's degree summa cum laude in 2011. He is the founding president of the RCNJ chapter of the National Organization for the Reform of Marijuana Laws, NORML, and he also sits on the Normal, New Jersey State Chapter Board of Directors as outreach director. Normal, New Jersey is a nonprofit corporation dedicated to uniting the millions of New Jersey supporters for marijuana reform. And now, to my left, let me start off with Diane Litterer, who is the executive director of the New Jersey Prevention Network. Diane has been in the field of public health for over 20 years and has developed state-of-the-art prevention programs that have received federal, state, county, and local funding. She manages several statewide initiatives, including the Addiction Training and Workforce Development Project, which provides training for the addiction field, the Military Family Project, serving service personnel and their families, the Training and Technical Assistance Program for 17 regional coalitions throughout New Jersey, and the CDC Community Transformation Grant that is addressing chronic disease prevention throughout 13 targeted counties. Additionally, Diane oversees NJPN's annual addiction conference, the largest addiction conference in New Jersey, which welcomed over 800 attendees in 2013. To Diane's left is Ray Ortiz, Esquire. He's an attorney coordinator for the New Jersey Lawyers Assistance Program. He has worked for over 20 years as an attorney specializing in the field of addiction. He is currently employed as a mental health and substance abuse counselor at the New Jersey Lawyers Assistance Program and has taught at Seton Hall School of Law and Brooklyn College and the Rutgers Summer School of Alcohol and Drug Studies. Mr. Ortiz provides training to the legal community on issues related to substance abuse and addiction. He has worked with clients in substance abuse treatment settings, including Turning Point and Eva's Halfway House for Men. And then to my far left is Kate Marinchak. She's a psychologist and addiction expert from Trinity College. She graduated from the Graduate School of Applied and Professional Psychology at Rutgers. She specializes in the field of substance abuse and harm reduction, and she has worked with the addicted population in both inpatient and outpatient settings, including at the New Jersey Veterans Administration Hospital in East Orange. Dr. Marinchak completed her postdoctoral training at Montclair State University's Counseling Center, where she co-authored an alcohol and other drug harm reduction protocol. She is currently employed as a psychologist at the Counseling Center at Trinity College. And so here's the format for this afternoon. I'm going to start off by giving each side, if you will, 3 minutes to present kind of a contextualization of their ideas and their thoughts. After that, we'll start asking you some questions, I'll start asking them some questions, and then you'll start asking them some questions. Throughout this, I think that we all will become greatly informed. We're going to start off with Ken, and Ken, if you want to come up and just give your 3-minute little to-do.
Thank you, Dr. Harris. New Jersey should adopt a program of legalized, taxed, and regulated marijuana distribution for adults similar to the program in Colorado. This is the most efficient way to meet the needs of the numerous patients in this state who can be helped by medical marijuana. Marijuana has tremendous therapeutic potential, yet countless patients will have to suffer needlessly for the foreseeable future without safe and legal access to marijuana therapy. The current policy of prohibition of marijuana is not only ineffective, it causes tremendous harm. After decades of marijuana prohibition, marijuana is more available, stronger, and cheaper than ever before. And the violence associated with the illegal drug trade is ever escalating and devastating to our inner cities. There are 22,000 marijuana arrests a year in New Jersey, most for simple possession. And this costs the state over $127 million a year. Those arrested and convicted for even a small marijuana violation often find that the consequences of that conviction have a disastrous impact on their life. These consequences can include expulsion from public housing, loss of student loans, loss of employment, loss of parental rights, loss of a driver's license. It makes no sense to destroy people's lives in an effort to keep them from using a plant that by itself has never killed anyone and is about as addictive as caffeine. The prohibition of marijuana rests on a fundamental dishonesty, that there are no accepted medical uses for marijuana and that marijuana is extraordinarily unsafe. Teenagers who are misled about marijuana distrust all drug education. For the last 30 years in a row, the Monitoring the Future survey showed that over 80% of high school seniors say marijuana is easy to get. This is the legacy of prohibition. It's harder for high school kids to get beer or cigarettes than marijuana. A system of taxation and regulation would impose reasonable rules for the production and distribution of marijuana, including responsible use by adults only. Colorado expects to add $130 million in its first year of legalized marijuana, along with all the avoided costs associated with enforcing criminal penalties for marijuana offenses. The use of marijuana is consistent with some of the fundamental principles of what it is to be an American, the rights to life, liberty, and the pursuit of happiness without harming others. Most people use marijuana as part of their pursuit of happiness, to increase pleasure, increase creativity, and decrease painful memories. But some people use marijuana as a holy plant that attunes them to their spiritual nature. Marijuana has been used as a sacrament in a number of religions, both historically and currently. And what is our government's response to this? We persecute this sincere religious belief. We throw them in prison and destroy their sacrament. There are important medical, financial, religious, and civil rights reasons to legalize marijuana in New Jersey. The prohibition of marijuana is not consistent with American ideals. Taxation and regulation of marijuana is a prescription for success in New Jersey. Thank you.
And next we have Diane Litterer.
afternoon. Yes. This is a very complicated topic, and legalization really is a very simplistic way of looking at it, and unfortunately a very dangerous way to look at it. I really hate being put in a side of kind of being against the whole con side, because as a public health professional, what I am about is, and what our field is about, is really creating healthy communities that support our youth and our families to grow and develop in a positive way. Legalization will not do that for New Jersey. We've learned, and you know, another thing we've learned is not to make the same mistakes that we've made in the past. So I'm going to quickly go through some slides because it's really a complicated issue, and I just want to be able to have some visuals attached to what I'm saying. We really, a public health approach, often people are talking about really switching it away from a criminal issue to a public health issue, and that certainly can be done by encouraging treatment and support to people who are identified as using drugs and are running into issues. But legalization is not part of the picture of public health at all. Public health is really about creating healthy choices being the easy choice, and marijuana is not healthy. Unfortunately, what legalization brings is an enormous industry associated with it, similar to the tobacco industry that was created back in 1964, where they hired doctors to tell the public how safe tobacco is. And we're seeing that same thing now in this movement towards, you know, really reducing the image that people have of the harm of marijuana. Really, this is what legalization looks like. These are pictures from Colorado and marketing and advertising. This isn't a matter of just not arresting people and putting them in jail. It's about creating an industry that's going to promote marijuana use to kids who haven't even started, to make it easy for kids to access marijuana. They'll say that they're not going to be promoting it for kids. Clearly, these real items, edible items, are certainly not adult items. Advertising, where they're giving free joints for when you purchase a lift ticket. Marijuana is addictive. Tons of research. I'm not going to keep talking about the fact that everything I'm saying is research and reality, but I can follow up with that. But it is addictive. Maybe not as addictive as some of the other drugs, but you know what? It's not all about how many kids die. It's about how many families and youth are affected negatively about drug use. And that's what we're trying to reduce. The harmful effects. Here you are students in college, and you really should be worried about your academic performance, and marijuana will impact that in negative ways. Really limiting both your future in employment as well as your academics. Increased fatalities and car crashes. This really talks about very little amount of people are actually put in jail for a simple possession. Most people are actually downgraded to for distribution for possession. It's really showing that what happens when you start legalizing and when you start talking about reduced harm, that's one of the research showing that perceived risk associated with drugs, if it's decreased, more kids will use, and these statistics show trends. When it's a clear no-use message and the dangers are associated with things, less use happens. Okay.
Thank you. All right, so now, what we would like to do is ask you what you think. And so if you have your cell phone handy, in general, the number to text for all of the things that we will be asking you today is the cell phone number 37607. For some of the questions, you'll need to text a different number into the body of your text message, and those will be obvious on the screen like they are right now. And so our first question to you is, do you support the legalization of marijuana for recreational use? And so you can see the yes and the no code so far. 2 people have voted. We'll give you time to get your phones out since this is your first question. And we have you so well trained to have your phones away and stowed. while you're busy voting, I'm going to give you a little bit of statewide and national context. So recently, the Monmouth University did a poll after one of our state legislators proposed a bill that would legalize marijuana, and that poll asked New Jersey residents what they thought about it. And New Jersey actually mirrors the country. In the state of New Jersey, about 49% of New Jerseyans say that they favor legalization. 48% said that they were opposed. This compares essentially nationally with those same numbers, about 49 to 48. In the state of New Jersey, there was a little bit larger portion of the population that was unsure. What we also know about favoring legalization is that it varies greatly both by party and ideology. The more conservative or the more Republican you are, the less likely you are to support legalization. But of course, if you look at our survey here and you look around the room, you can tell one of the other kind of grounding rules, and that is the younger you are, the more likely you are to favor legalization. And so nationally, statewide data, if you're under 35, about 57% support legalization. Between 35 and 54, it's about 45%. And if you're over 55, it goes down to 43%. So you can see that you are kind of a microcosm of that statewide data, because of course the age in this room is skewed a little bit. I'm going to turn now to our first question, and we're going to toss that to this side on my left first. And Kate, if it's okay, I'm going to start with you. Each panelist will have 2 minutes to respond to the question, and then we'll flip it over to the other side. And so our first question asks, do you believe that marijuana can be regulated the same way that alcohol and tobacco are regulated? Would it provide any unique challenges?
I do think it would provide unique challenges. Alcohol and tobacco are very regulated. That does not mean that they're safe, and we still see people using to excess. So regulation doesn't necessarily mean safer ways of using. We also know far less about marijuana than we know about other substances such as alcohol and tobacco. No one can tell you what a dose of marijuana is. We haven't studied that yet. No one can tell you how much marijuana will have what impact on you. So I think it would be difficult to regulate without knowing that more specifically, and to do that, I think we need more science.
Okay, thank you. Ray, do you want to take that one on? I can repeat that question if you like.
Yeah, no, I essentially have the same position as Kate, that I'm sure we can regulate it, but we can regulate alcohol, and we do regulate alcohol, and yet alcohol and drugs are the #1 public health issue in this country. So regulation is really not the issue. It's what happens if we introduce another drug into the population, we legalize it, and then what is the message that we're sending? By the way, although I'm on the con side, I favor decriminalization. I think for all the reasons that Mr. Wronski talked about. Yeah, but again, there is going to be a segment of the population that will become addicted. Now, when we hear things that, for example, it's not that addictive, well, that is actually not true. Here's what people who sought treatment, and they're by drug category. So 23.1% of people who sought treatment were for alcohol alone, 18.3% were alcohol and some other substance, 17% were marijuana. After marijuana, we have heroin, smoked cocaine, stimulants, and opiates that are not heroin. So that's the third leading drug of admission to treatment. So when we say it's not addictive, maybe we need to rethink that. The other thing I want to say is that, you know, the old great newscaster Walter Cronkite used to say, everybody's entitled to their own opinion, but nobody's entitled to their own facts. And at least if you have an opinion, please, everybody, try to find out what the facts are. Try to find out what the science is. Try to find out where we are in this debate, because everything else just remains as pure opinion, and it won't get us anywhere. There's enough confusion, misinformation out there about this substance that we're not going to make informed decisions unless we do a little bit of legwork and get to what is really going on.
Thank you, Ed. And Diane.
Thank you. I think one of the most significant issues is that, unfortunately, alcohol and tobacco goes through the struggle of teaching both parents and youth that they are dangerous. Because they're legal, people assume, why would the federal government legalize something that's dangerous? So as preventionists, we spend so much time working in clarifying, enforcing, creating new regulations so that, as well as educating folks as to the dangers of those two substances. Unfortunately, even with the discussion of legalization and many states having passed medical marijuana, you're already seeing significant increases in marijuana use among our youth because they're getting the message that, well, it's good for the people who are sick, so I should be able to use this substance. So that legalization is really dangerous as it relates to messaging to our youth. Certainly there can be discussion about the decriminalization. Again, we support treatment for people who need it, but we also want to put roadblocks and a clear message to our kids not to use. I'm sorry. I think also the risk factors, again, that we support, that we base our research, the research is based on, that really directs our prevention efforts. Early first use. The more available something is, the more likely kids are to use. A low perception of risk, as I've already mentioned. Social norms, when it becomes socially acceptable use, more kids will use. All of these things come with legalization, and we don't want to add another drug in the sources of drugs for our kids. I'm really fighting for the 80% of kids who are not using marijuana at this point. I don't want them to be encouraged by this switch in policy so that more kids are going down that path.
Thank you, Diane. And I will pose that same question to this side. Michael, we'll start with you. Do you believe that marijuana can be regulated the same way that alcohol and tobacco are regulated, and would it provide any unique challenges?
I think that it can be regulated. Obviously, they're all different substances, so there would be some unique challenges. Although I would say that the scope and the risks of those challenges have been greatly exaggerated. And I think it's dangerous to suggest that a legalized market would provide greater access for children. Today, it is easier for children to get their hands on cannabis than it is to get on alcohol or tobacco. So a regulated marijuana market would actually make it more difficult for children and teenagers to get their hands on it. And so I believe that a regulated market actually would help to achieve these goals that the opposition is describing, and I agree that they are legitimate goals. And I believe that regulation is the answer. If regulation were not the answer, then we would be prohibiting alcohol, we would be prohibiting tobacco, and there would be black markets for all those items with children available to get them. And I would take it a step further and say that legalizing marijuana is not adding another drug to the list of substances. Rather, it is adding a safer alternative. And I believe that with legalization, what we're likely to find is an inverse relationship between alcohol use and cannabis use. So alcohol use will go down if cannabis use rises. No one is also saying that marijuana is not addictive at all. Anything can be abused, even video games, and that's not even a substance, but people are addicted to them. So I think what's really important, above all things, is keeping an honest dialogue going where we keep the relative risks in appropriate proportion. Because what that Monmouth University poll also said that you didn't mention is that most New Jerseyans do believe that cannabis is about as dangerous as sugar.
I was getting
Thank you.
And Ari, we'll turn to you next, please.
Thanks very much. To answer the question, yes, I do believe that a regulated marketplace can eliminate some of the harms associated with marijuana use that are currently there in the black market. I don't think marijuana is a completely harmless substance. As Mike said, marijuana can be abused just like any other substance. Everything that the government's role is not necessarily to protect us from ourselves in all cases, and that's where I think actually the benefits of regulation can come in. So first, the black market is unregulated, right? This is a basic fact. What's coming in through the black market and essentially the black market marketing that goes to young people is not currently regulated. And one of the great things about regulation that can happen is we can bring these concerns about the approach to young people and build that into our legislation in New Jersey to be able to say, let's take a close look at how this marketplace is going to work. I know it was, we saw some of those colorful advertisement and marketing pieces, but that's not necessarily the necessary course, right? We as a society and part of the democratic process as we move forward in this conversation can be able to say, let's take a look at how we're going to implement this system and what type of regulations there's going to be for marketing and things like that. And secondly, I want to sort of start from that same place, which is to say, we have the power to decide how legalization looks and how it's implemented. It's not a fait accompli that it's one way or the highway. Concerns about prevention and education can be built into a taxation and regulation scheme. It's not as though we throw open the floodgates and marijuana rains down from the sky and in the playgrounds and children all get addicted. We have to be able to do this in a clever way and a thoughtful way to make sure that when we're implementing taxation and regulation, a public health approach is the grounding principle as we move forward.
Thank you, Ari. And Ken?
Thank you. Regulation is certainly possible for marijuana, and it's absolutely necessary to reduce the harms that are associated with marijuana use. First of all, it makes no sense to say minors can't use marijuana if you turn around and you say adults can't use marijuana either. That's just an unreasonable regulation. That's what we have now. We have total prohibition of marijuana. It makes no sense to say you can't use marijuana in a car if you're saying you can't use it outside a car either. That's just not a reasonable regulation, and it's not things that Americans are willing to accept. We want to accept reasonable regulations. It shouldn't be for minors. It shouldn't be while you're using it, while you're driving a car, and it shouldn't be for the workplace. These are reasonable things that our society is willing to accept and adhere to. But furthermore, regulation would entail labeling of marijuana, and then you would begin to understand exactly what it is in the marijuana that is available to people. The science of marijuana is advancing continuously since the discovery 25 years ago of the endocannabinoid system, and that is a very important system in the human body, and a system that regulates so many different processes in the human body. And the cannabinoids in the marijuana plant are beginning to be understood. There are over 60-some cannabinoids. So understanding the cannabinoid profile and how it works in the human body is very important for understanding how this marijuana is actually going to affect you and can minimize harms that are associated with it. And also the strength of marijuana. At least they would know whether or not this is marijuana that is exceedingly strong or if it's the marijuana from the 60s. But right now, it doesn't matter because you can't use the marijuana that's very strong, and you can't use the marijuana from the 60s either. And you can't even use hemp, which has no psychoactive properties. So the regulations now are inappropriate, and they must be much better regulated. Thank you.
Thank you, Ken. And so our next question, we talked, and I think that Mike touched on this, but when we turn our attention to those regulations, how should policymakers plan to control the black market for those under 21 to buy marijuana if it is legalized? And Ari, I'm going to start with you and work through this slide and then work over there.
So as I think we touched on earlier, how we build a taxation and regulation system has very much to do with what the outcomes are going to be once the policy is implemented. So I think it's likely that everyone would expect in New Jersey, as it happened in Colorado and Washington, that taxation, regulation, and legalization of marijuana would apply only to adults 21 years and over. So let's accept that as a arguable premise for what regulation would look like. Then we look at young people and how do we make sure that we're keeping in mind the harms that are associated with young people's use of marijuana. So number one, I think that what we've seen in the United States already is that more young people are using marijuana than are smoking cigarettes currently in the United States. It wasn't always that way, and how did we get there? A big piece, I think there's probably a lot of reasons for how we got there, but a big piece of the answer is that education works. Evidence-based education of young people about drug use works. We've seen significant declines over the past decade on cigarette use among teenagers, and that approach can work with marijuana, I believe, if we are building in prevention and treatment where necessary into our taxation and regulation scheme. The idea that reducing the stigma associated with an illegal product can open up conversations so that families and churches and schools can be able to have frank and open and honest conversations about marijuana use among young people. I think we've learned from in other contexts as well, the sexual health context, right? Abstinence-only education is not an approach that works with young people. Young people need evidence and they need real information to understand the risks that are at hand. I think this wasn't mine, but somebody else put it, we need to get from just say no, N-O, to just say no, K-N-O-W, and that I think is really the piece that can be built into our system.
Thank you. And Mike?
Yeah, I agree with all of that, and I would just emphasize by saying that right now we're not doing anything about children under 21 buying marijuana. By trying to prohibit the market, we are simply handing control over to whomever may be operating within the black market. Those people won't be asking for age verification from any of their customers, and in fact, they may even be upselling them cocaine. So if we move cannabis into a legal regulated framework, then there will be a process for age verification. There will be severe penalties for the business owner if they're caught selling to a minor, whether it be fines or having their licenses pulled away. And I think it warrants repeating, we've done an excellent job with the public education campaign for tobacco. Tobacco use among youth has dropped drastically, and that, to me, is evidence enough for implementing the same scheme for cannabis. Thank you.
And Ken?
Yes, there's still going to be a black market for marijuana after marijuana is legalized, but that black market is going to be incredibly diminished, much less than 10% of what it is now. I mean, yes, there's a black market for untaxed cigarettes, but compared to the overall sales of cigarettes, that untaxed market is virtually negligible. And furthermore, law enforcement would be able to prioritize its resources now to get to what we consider to be important aspects of control. For example, the use of marijuana by minors. So you're much more able to set priorities. And furthermore, you're able to be honest about marijuana. You know, when you're honest about marijuana and you're not relying on scare tactics, you normalize the use of marijuana, and it becomes less of a forbidden fruit. You know, when teens see patients, AIDS patients and cancer patients and hospice patients using marijuana, it's not glamorous for them. That's not something they want to emulate. Marijuana use among teenagers has gone down in the states that have legalized medical marijuana, sometimes significantly, as in California, for example. So, you know, there are many reasons to legalize marijuana, and as a way to control the black market, I think that it really is the best approach in terms of our regulation for it. Thank you.
Thank you. And I'll repeat the question. How should policymakers plan to control the black market for those under 21 to buy marijuana if it is legalized? And Ray, can we start with you, please?
Well, My position is that in many ways the black market can't be regulated. People are going to use substances. Our society is already awash in substances. We'll be adding one more. You know, contrary to popular belief, this country doesn't run on Dunkin' Donuts. Okay, this runs on booze, painkillers, marijuana, alcohol. That's really what's going on. And those of us who are on the addictions clinical side see daily evidence of this. We work with the people who become addicted. And it doesn't matter because the marijuana is an addictive substance, as I read to you, in terms of treatment facilities and who is seeking admission. The important point that I really care about, not in terms of regulation or any of these things, is what happens to the brain when someone uses marijuana? What's the same thing that happens when someone uses other drugs? That there's a part of the brain that is affected by it, and if everyone here could just take one finger and put it here, another finger put it here, and if you were able to stick your fingers into your head, the point where they would intersect, that's the medial forebrain bundle, would be where drugs and alcohol work, and that's where drugs and alcohol become addictive. I'm sure I'll get to more. There's 47 seconds left, but the other point I want to make is that there's no good scientific evidence, no hard empirical evidence that medical marijuana, okay, is good or should be legalized. None. I haven't seen it. Maybe it's there. I haven't seen it, and I make it a point to try to research these things because, again, I don't want to talk from opinion. I want to be able to talk to you from some facts.
And Kate.
This is a question that I can speak far less knowledgeably to. My perspective is not that of a policy person or a lawyer. I am a clinician, so I am a therapist. I work on a college campus. That's where I did my training, and that's where I am now. So what I can tell you is that in my experience as a clinician now at several different college campuses, alcohol is regulated, and it is not to be sold to students under 21. How does that work for people here at Montclair? Only 21-year-olds are drinking?
You can't get it, right?
So I can tell you that there is a tremendous amount of health education out there about smart ways to drink, how to drink in a safe manner, how to protect yourself, how to not use in a way that's going to become addictive. I don't see a lot of that going on. Despite the health education campaign that we've launched, despite all the regulations, there is still a problematic level of alcohol use on college campuses. And that's concerning. And there are many, many reasons for this. And certainly not everyone who's drinking on a college campus is drinking irresponsibly or drinking in a way that's going to cause them harm later. However, some people are. And those are the people that I see. And what I find is generally college is a very chaotic, exciting, complicated, difficult time in life when lots of different issues come up. Alcohol is a very quick way to stop thinking about all those things and to feel very differently. And if it's easily accessible and works really well, and I perceive the risk of it to be low, and I'm not super worried about the consequences, I'm going to use it. Legalizing marijuana across the board creates many of those same conditions, and I suspect that we would see a lot more use on college campuses, even if it's regulated in much the same way, and even if there is an age limit.
Thank you.
Just one more point, because I come from two perspectives, a clinical perspective and also as a lawyer, and I can tell you that although 8 to 10% of the population gets addicted to all these different drugs, they cause 70%, okay, of the problems in the judicial system. 70% of the people who are in prison are there for a crime that was somehow related to drugs or alcohol. All right, so we have a very small population that gets addicted. Why? Because they have the right brain to become addicted, but beyond that, then we have this other problem of what it's doing in terms of burdening, and the judicial system is bursting at the seams because of these substances.
Thank you. Diane.
To speak to the black market issue, really legalization will not eliminate the black market. So again, one more reason that the other side at promoting legalization, saying we're going to eliminate the black market, we're not. It's not happening in Colorado. There will still be youth that want to purchase. There'll still be people who want a higher potency that they, keep working on to get higher and higher potencies. So if the regulations are limiting that potency, there will be a black market for more intense marijuana that they'll be seeing the impact. Really, the current cartels and so forth, marijuana is a very small part of their business, 15 to 25%. They're going to stay in business. They're going to deal with human trafficking that's becoming a big issue in New Jersey, kidnapping and other illicit drugs. It's, they're still going to have a business. They're just going to shift to something else. So, it's really a bogus issue that let's legalize it so we're eliminating a black market. Just to respond, it actually, I totally support what folks have said about prevention working. But tobacco, for example, it took us many, many, many years and a lot of science that had to then counter very large profitable industry that's fighting us constantly about the messaging and the real information so that the public can be educated on these issues. And so finally, when all the science, really there's no science that says tobacco has any kind of benefit, it's, can kill you, it's the only thing used as directed and it's going to kill you, all of those things. I mean, it sounds absurd that that is still a legal product, but it's the industry. And so I keep getting back to legalizing marijuana is going to challenge those us that are in public health, that we're not just competing against misinformation and so forth, but we're then competing against a very profitable industry that's going to be fighting us constantly about the mixed messages and not really having to back it with science or information, but just misinformation.
Thank you. So we're going to turn now back to you and ask you another question, so if you have your phones handy. And so this question gets to your beliefs in a more specific manner. Do you believe that people in positions of responsibility, medical personnel, teachers, pilots, etc., should be allowed to use marijuana in their private lives, but be prohibited from being under the influence of marijuana while they're working? And as you are texting away, I would also like to note that this event is being video recorded, in case you haven't noticed, and it will be posted online. So if anyone wants to don their ski mask or duck out of the room, now would be the time to do that. If you're playing hooky from class or work. Let's look at our poll is still trickling in here. But it seems that there's obviously a clear majority who believe that there would need to be additional regulation. I think most of us were probably aware of the news story that occurred a couple of weeks ago, where a New Jersey Transit bus operator who was legally allowed to use medical marijuana was suspended from his position. And I think that this offers clearly some perspective in terms of the regulations that policymakers will have to face. I'm going to turn back to my right now and ask a question kind of about this issue, and that is, if marijuana were to be legalized, it would open a Pandora's box in terms of the need for regulation, including its use by those operating vehicles, teachers, people operating heavy machinery, and others in positions of responsibility. How can the state protect the interest of citizens who may be negatively impacted by people who are using marijuana legally? How can we get to the heart of whether someone is in fact under the influence if we can't smell alcohol on their breath, for example? Ken, why don't we start with you?
Well, how do we do it now? We're not introducing a new substance into the society. When we introduce marijuana into our culture, marijuana has been in common use in this culture since the 1960s. So, we already are dealing with these issues. Some of the workplace issues I don't think we're dealing with very well, quite frankly. No one here is arguing that people in position of responsibility, especially where public safety is concerned, should allow to be impaired on the job. And we have rules and regulations now for dealing with that problem. and up to and including termination of employment. But on the other hand, people who are using marijuana medically, for example, and they're using it off the job, and they are not impaired on their job, and they're using it under a doctor's recommendation, to my way of thinking, that's entirely inappropriate to penalize that person in any way. You're discriminating against people because of their illness. And it's entirely inappropriate and not something that we should support. But nevertheless, it does go on, and because marijuana stays in the system for up to 30 days after use, it's very difficult to actually judge impairment. So people get fired not because they're impaired on the job, but because they test positive for urinalysis that has nothing to do with their work performance. So some of that's entirely inappropriate. And some people absolutely need marijuana in order to function. Some patients cannot function and use marijuana, and without it, they would be at home on welfare. But marijuana, because it controls their illness or disability, it allows them to have a productive life in the workplace, and there should be no problems with this.
I'm going to take a liberty and try and get a little bit more specific. If the remaining two gentlemen might think about a scenario, say for example we have police officers in the room, or airline pilots, or people who are operating trains. In your mind, is it likely that policymakers will essentially have to tier a system where, when we're not talking about a medical condition that necessitates someone using marijuana, but rather using it for recreational purposes, that legislators will then have to turn around and say, you know what, marijuana is legal except for these citizens? Do you see that coming down the pike? And Mike, why don't we start with you and then go to Ari?
My opinion is that wouldn't happen. Anytime you're dealing with any kind of employment issues, there's a balancing of rights between the employer's rights and the employee's rights. I would expect that for especially anyone operating heavy machinery, that any court would probably side with the employer, that they have the right to put whatever restrictions on someone that they would expect. And I'd imagine that in general, although it might be somewhat controversial, I think in general, it's better to be safe than sorry when it deals with someone that's operating mass transit, like a bus or an airplane. It becomes a little less clear when you're talking about responsibility as far as, gosh, I don't know, a teacher in their private life, for example. You know, they're not operating a motor vehicle. In a situation like that, I would be supportive of the employee because it's not appropriate vis-a-vis their working responsibilities. That's how I feel.
Thank you. And Aaron.
I mean, I think both of my co-panelists here handled that very well. I think the premise of the question is flawed. The whole concept that we're talking about here is that legalization would dramatically expand use among firefighters, pilots, teachers. This is not, as Ken said, a new substance, and there's really no evidence that marijuana law reform in what is being proposed here has a direct correlation on a tremendous expansion on use. Well, the United States has some of the harshest and most punitive drug laws in the entire world, and we have some of the highest drug use rates in the world as well. There's not necessarily a correlation there between the severity or liberalization of our drug laws and how much use is done among the public. But because you brought up harms to the community, I think it's important to talk about what the existing system we have and the harms that it currently puts on communities. New Jersey every year right now arrests about 22,000 people for marijuana possession. That's over from the last decade, 2001 to 2010, over 200,000 people in New Jersey, or 200,000 arrests, I should say, were made for marijuana possession. And as we talked about earlier, that can result in jail time. It usually doesn't, but it certainly results in mandatory fees, a criminal record, driver's license suspension, loss of employment, time in jail after you're arrested, consequences for immigration, student loans. Let's talk about the harms that are currently being put on communities. When somebody loses their job because of simple marijuana possession, what's the harm on that family? When somebody's deported because of simple marijuana possession, what's the harm on those communities and that family? And this is not happening in all communities, we need to keep in mind, right? In New Jersey, African Americans are more than 3 times more likely to be arrested for simple marijuana possession. So for some of us who live in certain communities, we may be able to say, right now the harms would be so much greater if we liberalize our marijuana laws, but we have to take a close look and say which communities we're talking about, because right now there are communities in New Jersey that are suffering greatly from the existing marijuana system.
And now I'll turn to my left. I wanted to ask a question, and this was something in the planning of this symposium that I started to learn a little bit about, but I'd like you to talk for a minute about whether or not it is fair to label marijuana as a gateway drug. Diane, why don't we start with you, please?
Well, you know, we really are moving away from the terminology gateway drug for 2 different reasons. One is that gateway kind of implies that that drug that might be the start of someone's path to addiction has no danger in itself, so that it's sort of just a gateway drug and, you know, and so forth. So we really are talking about the fact that no, not everybody that uses marijuana moves on to other drugs. But if you actually, you know, communicate with people who are, you know, had used heroin and are in full-fledged addiction, maybe from something else other than marijuana, and you ask them their path and what they started with, very often you'll hear alcohol, marijuana as being one of the 2 things that people did start. And it's really under the influence of those types of drugs that, number 1, could potentially have dangers in itself, but also could lead to other behaviors that they normally wouldn't do, or a lack of understanding of the risk moving to another level, people looking for the stronger high and those kinds of things. So I think that's why some people use that terminology, gateway. I really, you know, it's sometimes we look at the last day of addiction, whether it's a crash, a car crash, or an overdose, the tragedies that are happening here in the state with the heroin overdoses, we look at that last day and say, oh my goodness. But what we have to do is start moving upstream and look at the first day. What turned that one person that ended up at that car crash? And a lot of people take a variety of paths, but what we do in prevention is try to prevent that first day, so that we're not seeing the death and the harm. And whether it's death or whether it's just impacting negatively that they end up, you know, committing a crime under the influence, as Ramon said, you know, that often happens under the influence. They're doing things they wouldn't normally do. We really want people to stay clear-minded so that they can be successful and healthy youth.
Thank you. Ray.
Yes. Since 1980, our prison populations have quadrupled. Most of this is because of the drug laws. And this is why the first point that I made is really the examination. And the examination should be as between legalization and decriminalization. As my colleague said on the other side, look at what's happening to communities because of what? Because of the criminal laws associated with these things. That's one thing. With respect to the gateway issue, pour tobacco. Tobacco used to be the gateway drug. I wonder how tobacco feels now, all right? And when I looked into this gateway issue, guess what I found? And this is part, again, of all the misinformation that we suffer from on these topics. I found one source that said that it is a gateway drug. I found another source that said there's no support for the gateway theory and that it's a myth that will never go away. Then I found another study that quoted the very same study of 104 teenagers who were tracked throughout life into their, elder years, and that study was totally contradictory and stood now for 2 different things, whether it was a gateway theory or wasn't a gateway drug. It's all very confusing out there. For every, one of the things I was discussing with my colleagues is that, people form an opinion first, And then we find the facts or the basis to support our opinion. You know, Jerry Garcia said, "You ain't gonna learn what you don't wanna know." And much of this debate happens to be because of that. We've already taken a position. A lot of times it's behind our feeling. There's a lot of emotion involved in all of this. And we take that position and we employ something called contempt before investigation. So we listen and we listen to the people that are con. If that's our side, yeah, I like that. We listen to but it's much more complicated than that as we're trying to get to here today. Much more complicated than that. And I think if we move too fast, we make a mistake. There are several issues, including the medical marijuana, that needs to be explored more. Thank you.
I really appreciate that you asked this question, because I think that term gateway drug is a very emotionally charged term that gets thrown around a lot as a reason why marijuana is bad. And I think my position on this might sound a little controversial, but my answer is I don't know. I don't know if marijuana is a gateway drug. I don't think anybody knows. Anything can really be a gateway drug. And I'm not really sure what it matters in terms of legalization, whether or not we could magically find out if marijuana is a gateway drug or not. Just because it doesn't necessarily lead to other bad things does not mean that it's not bad in and of itself. And that's what we should really be focusing on. Not whether it's gonna lead us down a really bad path, but is it a good decision for a specific person to make at a specific time and place in their life? And so what I can tell you is that while I think any substance can serve as a gateway drug, marijuana does do some things very specifically to your body that may make it more likely later on in life that you're going to go on to develop an issue. Specifically, marijuana fundamentally alters brain structure and patterns of brain activation. And it does that in the parts of your brain that are responsible for decision-making, planning, organization, focus, concentration, and impulsivity. So if you are fundamentally changing the part of your brain that has to do with impulse inhibition, it's going to be much harder to say no. And you may make decisions later on that you might not have otherwise. So I do think there are neurobiological impacts on your body from marijuana that could lead you down a different path. But certainly there are many people who smoke marijuana who never go on to use any other drugs, and we can't discount those people either. Thank you.
All right, and now is your chance. By the way, those questions were primarily derived from questions that were submitted by participants, that means you, before the event. And so those were emailed into some of the event organizers. But right now we'd like to give the folks in the room the chance to formulate questions. The instructions are up on the board and you can probably see them better than I can. So what you're going to do is use that cell phone number that I gave you, 37607. That's what you're dialing to. And then you're going to use that little code that appears first that begins with a 6 and pose your questions. Steve over there will get them and they'll magically appear on our screen. While you're doing that, I'm going to ask an additional question to our panelists. And so why don't we start with you guys? This gets more to some of the debate that has been occurring within the state of New Jersey. Will legalization of recreational marijuana improve the budget shortfalls in the state of New Jersey? And if so, how should these funds be used? We know that this was one of the prime motivating factors for the piece of legislation that is now in the state legislature. And so if you would like to talk about that, Mike, why don't we start with you and move on down the line?
Yeah, certainly. And thanks for bringing that up. I would actually argue that that is not one of the prime motivating factors because no matter how much money you get from changing a policy, the money will not make a bad policy into a good policy. So while I believe that that issue is being addressed now because budgetary constraints are now allowing those who've been politically entrenched to rethink their decision, the money is not the issue. The issue is all of the arrests that we have, the cost of enforcement, the fact that prohibition does not serve the very legitimate interests and goals that it was designed to achieve. the fact that our medical program is failing to provide for the patients while simultaneously criminalizing them, these are the reasons why the bill is being introduced. But the money is also great. So in New York, money is proposed to go towards drug treatment. I know in Colorado, they want to send it towards schools. Senator Scutari has proposed most of this money going towards New Jersey roads. I think that's a great use for it because we need it direly. And the rest is intended for education and drug counseling, I believe. So all those are actually very valid things, and I think as it goes on, you know, we're not going to have to constantly be rebuilding the infrastructure. There's going to be a lot of money coming in, so that can be then reallocated towards additional treatment or additional education, prevention campaigns.
Thank you. Ari.
I mean, I'll start by saying that for the ACLU of New Jersey and for myself, I'm a civil rights lawyer. I don't come to this work because I want to balance a budget or come at it from that approach. Right? This is a civil rights issue and an issue right now in New Jersey of great injustice, and that's sort of what brings us to the table. And to the extent that a conversation about budget deficits opens some otherwise closed minds to looking at sort of efficiencies in the system or things that are not efficient, and ways to look at evidence-based policies that they haven't before, I think that talking about the budget is a fine way to engage that conversation. I mean, here's what we know right now as far as the fiscal side. Estimated in New Jersey enforcement costs, which deals with police, courts, and corrections, we're looking at about $127 million a year in New Jersey for marijuana enforcement alone, and that is an estimate. It's very difficult to estimate those numbers. As far as the revenue side, we don't know. We don't know. And a lot of that has to do with the tax rates that end up getting set. There's a very, I think, sophisticated approach that New Jersey would ultimately make to make sure you set a price via taxation at the right place so that it's not very easy for young people to meet that price, but likewise can undercut the black market. And so there's a lot of work being done now in Washington, Colorado to think about what that price point is, and that's very important to make a successful policy. But as far as predicting revenue, we don't really know, and we're going to learn soon about from other states. But I think the conversation comes back to what we were earlier speaking about, is that this is a conversation that New Jersey communities should be having right now. The tax and regulation would ultimately generate revenue, and we need to be talking about where should that money go. If we think that it's roads, that's one thing, but it's not necessarily roads. I think to do this right, we have to think holistically about building a system that's going to be successful and that keeps communities safe and strong, and all communities, and treatment and prevention, and ensuring that a massive big box retail marijuana industry that doesn't sort of have community safety and justice in its mind is not what springs up in its place.
Thank you. And Ken?
Thank you. I'm a registered nurse. I've been an RN practicing in New Jersey for 38 years. So I see this from a healthcare perspective, the benefits of legalizing marijuana. And we need to not focus, I think, so much on the harms as some of the potential benefits from legalizing marijuana. We can see decreased hospitalizations, we can see decreased surgeries, we can see decreased reliance on pharmaceutical drugs, and this can provide tremendous financial benefit to patients who are suffering in New Jersey. Additionally, there was actually, we talked about it, the gateway myth a little while ago, but marijuana has actually been shown to be a reverse gateway. In a 2009 poll of 350 users of medical marijuana in Berkeley, California, they found that 40% of the people used marijuana to control their alcohol cravings. 66% of them used marijuana to replace prescription drugs, and another 20% used marijuana to replace more dangerous and addicting street drugs. So, you know, there are very real benefits to be realized from a policy of legalizing marijuana for patients. You know, when we reduce the harms that are associated with alcohol, with prescription drugs and whatnot, you know, we're doing a tremendous service to our population. There was a young man who suffered from Crohn's disease who was growing a few marijuana plants in his closet, and he was busted, and they took his baby away from him, and because of this, he had an outbreak of his Crohn's disease, and he had to go for multiple major abdominal surgeries. And you know, he had his condition completely under control simply with marijuana therapy. And you know, it really is a shame the way the money that's being wasted now on our current policies.
Thank you. And to my left, I'll repeat that question. Will legalization of recreational marijuana improve the budget shortfalls for the state of New Jersey? And if so, how should these funds be used? And Kate, could we start with you, please?
Sure. Again, this is a question that's a little bit outside my purview and my area of expertise. But what I can kind of comment on is that a budget needs to balance, and tax revenue does not always mean more money for people depending on what additional costs are accrued by a change in legislation. So if we're going to make marijuana more accessible, more people are going to be smoking it, and you know, percentage-wise, some of them are going to start to use in very problematic ways that are going to have public health costs. There's going to be more trips to the emergency room. There's going to be more people who are seeking inpatient and outpatient services who may be doing so with public funding. So I do think that while obviously there's going to be some tax revenue, there's going to be associated public health costs that are going to come along with that. And another point that I'd like to make is that treatment is far less expensive if I can get to you earlier on. So I do think there's a way that some of the potential benefits of legalizing marijuana actually kind of work against people's desire to seek treatment earlier. If it seems like it's a legal drug with few perceived consequences and I feel okay when I'm using it, I'm probably not going to think that it's a problem and seek treatment. And by the time that I need to, I may be in a far different state, a far different level of addiction, and I might need far more intensive services which are going to cost a lot more money, whether that's coming out of my pocket or whether that's coming out of the public funds.
My own view is that legalization is almost inevitable. Why? Because of the money. Follow the money. We live in a capitalist society. That's the way it's going to go, I believe. I was also happened to be involved in the drug courts when they were first forming. And I was going out every night talking about drug courts and why we should have drug courts. That is diversionary programs so that people don't go to prison and rather they get treatment. And it was very hard to convince people. But two of the things we were finally able to convince people of was number one, that treatment works. And number two, that it is less expensive to have drug courts than to put people in prison. And so that won the day for us. Now, if one of my colleagues on the other side said that if we're going to legalize it, and for me, whether we decriminalize it, legalize it, you know, it doesn't really matter. What we really need to focus on is treatment, access to treatment, and prevention. Why? Because we know all those things work. They work. And so if we can do you know, something to help people with the problem, then that's it. We've had education in the past, by the way. But when I say education, we need to really look for the best possible education. The education we've had in the past was really not the best education. There are 3 well-documented programs, 3 well-documented failures. The DARE program, the Just Say No program, and the Scared Straight program. You all can remember that commercial where there was 2 eggs frying, you know, in a skillet. And this is your brain on drugs. You know, sure, give me a side of hash browns, too. You know, those are not the things that work. So, again, we have got to look at and what is evidence-based in terms of what works. And that's what we need to do on this debate. Thank you.
I have to respectfully disagree that I don't think legalization is a done deal. I actually have faith in our legislators that they're going to put the brains of our youth, the minds of our youth, ahead of the dollar signs. We don't want to sell out our communities and our youth in legalization, which is what the case is going to be. I also respectfully disagree that any of this conversation today regarding legalization should mention medical marijuana. Medical marijuana is approved in New Jersey. Whether that discussion to expand that and so forth, our support in that is really to encourage FDA research and do it the right way, like we do other medications. But setting that aside, what we're talking about is recreational marijuana, not medical marijuana. So all of the potential benefits needs to go down the road of research. I also want to point out that, again, lessons learned, both in alcohol and tobacco. For every dollar that we get in tax, it costs the communities $10. Huge dollar amounts that it's going to cost. And so maybe there's some shifting, as the other side was talking about, but the increased expenses as it relates to legalization, increased use, and so forth is really astronomical. If the state really wants to generate additional revenue, they should increase alcohol tax. The malt liquor tax is 5 cents. I mean, it's ridiculous. It hasn't been changed since the Korean era, if you look at inflation and so forth. There's ways to generate funding. I also wouldn't want to support another industry that actually makes their money off of our youth and off of those suffering from addiction. If you look at the revenues generated from the alcohol industry, 70% of their revenues are really off of underage drinkers and problem drinkers. So why would we want to add another industry and legislators sign on to selling out our youth in our communities?
Alrighty, and the winner is, drum roll please. All right, I have a card, so I'm going to cheat over here, and I'll start asking this question off to the gentleman on the right. Ari, if we could start with you. And the question is, will legalization of marijuana help to reduce the criminal justice cost of imprisonment related to marijuana possession and other related crimes? And I'm going to actually throw in an idea here that Ray was talking about the difference in all of your perspectives about the, desirability or benefits of decriminalization versus legalization, and what that would mean, both in terms of the costs associated, but also in terms of what the state's obligation is.
Sure. So to directly answer the question, right, we spoke before, the estimate right now for New Jersey is that enforcement costs for marijuana possession are at around $127 million a year. And again, it's an estimate, and part of that is hard to isolate marijuana from other enforcement, but that is the estimate. So as we move towards a taxation regulations scheme, you would see, hopefully, those costs reduced and diverted to other uses, and hopefully allow law enforcement to target violent crime and the real top priority criminal justice needs in communities across New Jersey, of which violent crime is a serious one in many communities. As I mentioned, the revenue, how that would work on a fiscal side. But when we talk about the cost of the criminal justice system, it's not just fiscal costs. As we mentioned before, the costs on communities of rates of incarceration in the United States are tremendous. The public health costs, and I know from my colleagues on the other side who may be familiar with some of this literature, that the relationship between the experience with the criminal justice system, particularly incarceration, and other health outcomes, heart disease, psychological distress, those are all costs that come as a result. Now, Diane earlier mentioned that simple possession is not a direct line towards sort of long prison terms, and that's correct. But what we do see is individuals getting wrapped up in the criminal justice system from an arrest. You have a criminal record. The next time you might get in trouble for something else, it becomes a much more serious offense, and there's a snowballing effect of people getting wrapped up and tied to the criminal justice system. Briefly on decriminalization versus legalization, right? The difference, for those who don't know, right? Decriminalization would remove all criminal penalties. Legalization would remove all penalties, period. I think the evidence from around the country so far, New York, our neighbors to the east, in 1977 decriminalized marijuana. In 2010, there were over 100,000 arrests for marijuana possession in New York State. In Ohio, they decriminalized in 1975. There was over 20,000 marijuana possession arrests there. The nature of modern policing is such that there's a ways around the decriminalization scheme that still lead to arrests and still lead to folks, particularly communities of color, being wrapped up into the criminal justice system for simple marijuana possession. So I think that is a strong argument in favor of removing the penalties so that incentive for arrest disappears from the police.
And Mike.
Okay. So regarding decriminalization versus legalization, decriminalizing would not create a regulated structure. It would simply make the possession of cannabis legal. So the exact points that we are advocating for legalization are absent in a decriminalized scheme. There is no regulated network of distribution, therefore no one verifying the age of people who purchase it, no quality controls for the product. So my opinion is that although decriminalization is better than a criminalized, prohibited cannabis market, legalization is the preferred way to go, because legalization, ironically, will realize all of the goals of every person on this panel. Regarding the costs of criminal justice, you know, the costs are not only the cost of enforcement. The revenue generated is not just the revenue that comes from the sale of cannabis. Today, there are farmers who are given subsidies because they need subsidies and they're not growing crops. You know, we could then give them another crop, hemp, for example. And I know that the colleagues on the other side would prefer that this issue was restricted to recreational cannabis, but this issue permeates every level of society. The medical marijuana community would be better served if there was a legal recreational market, and industrial interests would be better served if there was a legal recreational market, because then hemp and medical marijuana would all be able to come in. It is unfair to exclude the situations where there are people with bona fide medical necessities who are in turn made into criminals and incarcerated for using their prescription. So on that note, you know, the costs and savings are far beyond just cannabis.
Thank you.
Thank you. Decriminalization still enriches the black market rather than the state of New Jersey, which is inappropriate. Furthermore, the level of marijuana and the type of marijuana that's available through the black market is limited, of questionable value, not subject to any kind of quality controls, and so it really is inappropriate, especially for medical patients. But if I could just talk about the mass incarceration that we're experiencing here in the United States. I worked in the New Jersey Department of Corrections for 22 years as a nurse in various capacities from 1984 to 2006. And I saw the prison population triple just in the time that I was there, from 9,000 inmates to 27,000 inmates. And 86% of those inmates in 2006 were black and Hispanic. So the cost to our society from this, and what drove this mass incarceration was the war on drugs, which was enhanced penalties for drug violations and enhanced enforcement of the kind of drug laws. And about 50% of that war on drugs was a war on marijuana. You know, you say that people don't go to jail for marijuana. Well, that's not true. I worked in a maximum security prison, and I saw many people in jail with marijuana offenses. And they don't keep track of them the way you know, for example, if you violate parole by turning in a dirty urine, you know, you're in jail for, you know, basically a marijuana offense. And this has such a devastating effect on the communities, our inner cities, that, you know, when you arrest a person, you're not just, you know, affecting that person, but you're affecting the entire family. You're affecting his children. You're affecting the socioeconomic status. You know, you talk about marijuana reducing IQ. If you want to reduce somebody's IQ, throw them in prison. And you'll reduce the IQ. And you reduce not only his IQ, but the IQ of his entire family as well, because you reduce his socioeconomic status. Thank you.
Thank you. And Ray, if we can start with you, I'll repeat that question. Will legalization help to reduce the criminal justice cost of imprisonment related to marijuana possession and other related crimes? And if you could please also talk about the distinction that you were making between decriminalization versus legalization.
Well, I think that, again, I'm for moving slowly on this, and for me, it's looking at decriminalization first, and then, moving to legalization. There's no doubt that the number of people who are being hurt by both not decriminalizing this or legalizing it is huge. All of these addictions are not just as to the individual. All of them are family problems. All of them will affect people in the family. Okay? And so when we're talking about the 8 to 10% of people who become addicted, multiply that by the people in the family who are affected by this, and look at the numbers that you have. And the other point is that when we talk about 8 to 10% of the people becoming addicted, we're talking about millions of people. And this is what is going to happen if we bring, and gambling tells us this, the more we open up gambling, for example, now online gambling, the more people come in and are caught by the net. So that's going to happen also with the legalization of marijuana. My focus is on the individual who becomes addicted. And because of that addiction, he now has job or vocation problems, he's got family relationship issues, he's got financial issues, he's got health issues, and he's got legal issues. That's the focus of the person. And those persons are going to continue. But again, if we want to be wise about this, if we're going to do either criminalization or legalization, let's make sure that we have prevention and education in the picture. And let's make it good prevention and education. Otherwise, we don't have a chance. Thank you.
And Kate.
Going to prison is not the only thing that derails a person's life. Certainly going to prison disrupts your life, has tremendous consequences for your vocational, professional, financial, familial ambitions moving forward. But addiction does that too. And this often gets framed as a very black and white issue, like we either legalize it or send people to jail, and I don't think that's the truth. I don't think that marijuana should be legalized across the board. I also don't think it's helpful to send people to prison for using it. Addiction is a mental health issue, and treatment works. And the cost of sending someone to prison is that you short-circuit their ability to look at the choices that they're making, to look at issues that might be fueling problematic use, and you send them to a place where they're not going to get that help. And so I don't think, saying that there are problems with the way our current system works does not necessarily mean you have to go the other way and say that we should legalize it. Certainly there are problems with the way our system works. People are being failed by this system, and people are getting out of prison and continuing to use drugs. So it's not a helpful intervention. I do think the treatment works. I think there are interventions that do work. And I do think that finding a way to tweak our policies so that we're emphasizing prevention, health education, treatment, alternatives to prisons is a much more productive conversation to have than legalize or send people to prison.
Very good.
And Diane.
I'd like to actually use my time to focus on the issue of disparate communities. In public health, we're very well aware of the disparities in health-related issues in our most vulnerable populations and communities. Actually, if you look at the broader health life expectancy, it actually depends on the zip code you live in. So I totally acknowledge that issue, but legalizing marijuana to thinking that that's going to resolve the issue of our vulnerable populations ending up in prison is really misstated. As mentioned, again, on the other side, the reality is, unfortunately, that they say 70–80% of the people that are in prison are due to use of drugs, and that's under the influence, because you're much more likely to commit a crime under the influence when you're not thinking clearly. So yes, it's going to impact not that it's legal, because actually more people are in prison due to under influence of alcohol, both related to breaking the regulated laws associated with alcohol, as well as in actually doing a crime under the influence of alcohol. I think the other piece is, unfortunately, legalization, we've learned from alcohol and tobacco that this funded industry actually targets the most vulnerable populations. So you're now putting in the hands of additional people who want to access our youth and our minority populations within our communities. If you look at where the alcohol densities are the most intense in our communities, it's in those same populations and in those same communities. The tobacco industry specifically targets billboards and those, and their advertising and so forth, because those are the most vulnerable populations. So those are the things that, as public health professionals, we're trying to avoid with legalization. I've been working in the community for 25 years, mostly in the early years in Union County, working in the most vulnerable communities of Elizabeth and Plainfield, so I understand the impact that drugs and alcohol have on these communities. And legalization is not the answer. It's just going down a much deeper road and unfortunately going to impact the lives of our youth and family in New Jersey.
Thank you. And if you could take your phones out again. We'd like to ask you, if it was legal, would you personally use marijuana? Just to see who we should have asked this first off.
Watch out for the NSA.
Oh, those two people
just kidding.
that are back. So same two.
Say yes.
Yo, everyone's saying people are thinking about it. While you're deciding, I'm going to turn our last question. I'm going to re-ask the question that I asked you in the beginning in a minute, so don't put your phones away when you're through, and we'll let this progress. But it looks like we have a majority of people who would use marijuana. I'm going to ask each of the panels to talk a bit about their position, but also, now that you know their positions and you have a bit more information, what you might be able to do. This is obviously something that is not going away. This is an enormous issue that will be following us for the years to come, both in our state and in our country. And so if I can ask you both, what actions would you suggest to supporters of your position in terms of advocacy on the state level? And why don't we start with Kate and move our way down. Let me think about this. Why don't we start, I'm sorry, with Mike, and we'll end with these folks since we started with you guys. So why don't you, Mike, why don't you start off and we'll work our way down.
Great. I am the Outreach Director for NORML New Jersey. NORML is the national organization to reform marijuana laws. I'll give you all my email. It's Mike at norml.org, normlnj.org, N-O-R-M-L. There's no A in NORML. If you're interested in contributing towards our cause, towards freeing the flowers, just come and either visit me or email me. I'd be happy to show you how to get involved. Right now, we are making a concerted effort to garner support for Senator Scutari's tax, legalize, and regulate cannabis bill. And I'll hang out and wait for you when we're done.
Thank you. And Ari?
Sure. So I think a theme of what I've said sort of from the beginning here is that this is a conversation that's now happening in New Jersey. And for whether you have concerns and deeply held concerns about how this is going to turn out, or whether you already believe that taxation and regulation is a good policy choice, now is the time to engage in this conversation. Taxation and regulation, as I said, doesn't look like one thing or another. It doesn't necessarily look like tobacco and alcohol as far as marketing. It doesn't necessarily look like the targeting of certain communities for the location of stores. All of these things are up for debate and up for discussion, and they will only turn out the way we need them to turn out if all of us get engaged and actually shape a policy that is going to make communities stronger and safer and healthier. And that's where I would encourage folks, particularly those who have concerns about that, don't just say no to reform, to come to the table and talk about it. So on behalf of the ACLU of New Jersey, we are going to be involved in this discussion for the years to come. We have not taken a position on Senator Scutari's bill. We see that as a starting point for this conversation where all of our voices can be part of the debate and on shaping something that makes sense for New Jersey communities from top to bottom. So visit our website, www.aclu-nj.org, and we'd love to have you be a part of the conversation.
Thank you. And Ken.
Thank you. I am Executive Director of the Coalition for Medical Marijuana New Jersey. We're a nonprofit 501c3 educational organization. We're all volunteers. We have meetings on the second Tuesday of every month at the Lawrence Township Library outside of Trenton from 7 to 9 p.m. If you're unable to make those meetings, you can always go to our website, cmmmnj.org, and sign up for monthly emails to get our agenda, to get our minutes of our previous meetings, and to keep on top of what's happening in New Jersey. There are many events that we would invite you to come out to show your support for, right now, our organization has come out in support of legalization of marijuana as the best way to meet the needs of so many patients in New Jersey. So we do this in a variety of ways. We're very active on Facebook at the Friends of the Coalition for Medical Marijuana New Jersey. I would invite you to join our Facebook page and keep up to date with what's going on there. And I also want to let you know that there's going to be a wonderful conference in Portland, Oregon on May 5th, May 8th, 9th, and 10th. Run by Patients Out of Time. I'm on the advisory board of this national organization, and this happens every 2 years. CEUs for nurses are granted. It's an educational conference. They bring together some of the finest scientists from across the country and around the world to talk about the latest science of marijuana. And I would encourage you to really learn about this endocannabinoid system, because it really is a science that's going to grow up with you as college students. The remarkable discoveries have been made about how marijuana actually works in the human body and why it's so effective for so many different symptoms and diseases and conditions. And this knowledge is only going to increase in the years to come, and you should be a part of it. I'm also part of the American Cannabis Nurses Association, and we're having our first certification exam out there and course program at the Portland conference in May. So thank you very much.
And I'll repeat the question again for the folks on my left. What actions would you suggest to supporters of your position to take in terms of advocacy on the state level? And Kate, if we could start with you and work our way down, please.
Sure. So my job in the coming years is going to be to help shape this conversation on the college campus. In my role as a staff psychologist at Trinity, this is a hot button topic, as it is here in New Jersey. And my first piece of advice to anyone who's in this room who might agree with me or not, frankly, is to get and stay involved in the conversation. Because this is a conversation, and only through conversation are we going to be able to educate each other, better understand where people are coming from, and help shape the policy of our community in the way that we want moving forward. You and I might disagree on what shape that policy might take, but your voice needs to be in there too. And I will learn from you as you will learn from me. So I appreciate everyone who came out today. I hope people continue to come out, and I hope that you continue to have this conversation when you leave this room. We talk a lot about the impact of drug addiction on communities. The college campus is a community. Your college is your community. For 4 years of your life, you live here, you work here, you know many people in many different levels. And I'm sure if you haven't seen it already, many of you will come to see the impact of problematic use of any substance, but especially marijuana, and addiction. So pay attention to that. Get involved, understand the impact of addiction on families, roommates, communities, classmates, and start to think about how that might apply to you or might not apply to you, and what you want to see the conversation looking like moving forward.
Of course, I agree that we keep the conversation going, and that everybody make it a point to try to find out more about this, and especially try to look into the brain research, because there's certain things we know from the brain research that are really, really be enlightening to you. You know, I went to college in the late 60s, early 70s, And that just says everything you want to know. I certainly used the substance back then, but if I knew now, then what I know now about its effects on the brain, maybe I'd be more careful. And that's the other thing. Again, whatever behavior you want to engage in, you can do that, but make sure that you also research what's going on, especially what's going on in your brain. I mean, it's your most precious tool. In essence, what we do as human beings is only three things. We think, we feel, and we act. The science seems to say that all three are affected by marijuana use. And I want to be honest. The majority of people will not be affected by, will not become addicted to marijuana. But again, when we talk about that 8 to 10% of the population that does get addicted, we're talking about huge numbers of people. And it just might be you. When I get a lawyer coming in, it doesn't happen quickly. It won't happen overnight that someone will know that they have a problem with marijuana. Most of the lawyers come in to see me say one of many different things. One of the things they might say is, Ray, I never expected to be here. Ray, I never thought that I would get to this point. And because addiction, see, works very quietly, very slowly, very progressively. It doesn't just happen from one day to the next. And so be careful, eyes wide open, as you go through all of this and see if it's having an impact on you. See if it's having an impact in all those areas that we talked about before you can start to say, well, maybe it's not a good thing for me, because most people would not become addicted. But for me, what will it do to my life? What will it do to my success in life? Thank you.
Yes, I'm from New Jersey Prevention Network, which is a statewide public health agency, but there is a comprehensive system of prevention agencies that are working throughout the state in your communities on a regional level, county level, and down to the municipal level. You can go on njpn.org to find out how to get involved with your local organizations. I think that the state needs to realize that this is not a given. We really need to educate our legislators that they need to be supporting our youth and our communities, and this is not the solution. Our communities can't be sold out to try to balance our budget. We need to be really concerned about the lives of our youth, and the science is behind what we're talking about. There's years and years of research and science, and that's what we're doing. We're not against anything other than, bad choices in trying to come up with a very complicated solution for a very complicated problem. I don't think that our kids should be a science experiment, really. I mean, I think that we have the research. We've learned from both the alcohol, tobacco, and we're learning from Colorado. This is not a good solution. I don't think we should be giving up on our youth and our communities and thinking that, oh, they're going to use anyway. We've been fighting that battle with parents. It's not, they're just using alcohol. They're just using marijuana. Those things come with consequences that can be very much impacting our communities. But we need to have a balanced approach and a balanced conversation. Some of the issues and the reasons why they think legalization might solve some of them, their problems are real, but the solution they have is wrong. And we know what can work, and it's a matter of people being interested enough to sit down and dialogue so that we can come up with common solutions. I think we really need to make decisions based on the science and the research. I often use the information about car seats. Many of us here weren't put in car seats. We survived, and our parents weren't bad parents. But now research and statistics show kids need to be put in car seats to save their lives. So we need to use those same logic of science and research and statistics to show how laws need to be developed to help protect our communities and our youth. Thank you.
Very good. Very good.
All right, and now I would like you to please take your phone out for one last time. I'm going to ask you the question that we started out the afternoon with, and that is, do you support the legalization of marijuana for recreational use? Perhaps your mind was changed today, or perhaps you became less sure of the position that you walked in the room with. While you're doing that, I just want to extend a couple of thank yous. Thank you to you, first off, for coming. Thank you also to facilities and campus police and Steve McCarthy's people who are videographing today. I also want to thank our event organizers. First off, Christine De Jesus, who seems to have disappeared. She's back there. Many of you know Christine. She is the coordinator of the Alcohol and Drug Program, and she's also staff psychologist here at Montclair State University. Secondly, Marie Cascarano, who's the... I love how people have their cheering sections. She's the coordinator for health promotion here at the university. And Stephen Tolman, who is the director... Woo! I'll just... The Associate Director for Student Involvement. Finally, I also want to thank our panelists who did an absolutely fabulous job. We all learned a great deal. I thank you all for coming today. And I invite you to a little bit of snacks and refreshment and conversation in the back of the room. Thanks so much.
Summation?
That was our